Taiwan reported 1,390 local COVID cases on Monday, once again reaching a new high in the daily tally. The CECC says that since the start of the year, 99.54% of confirmed cases have developed mild symptoms or no symptoms at all. Only 47 patients have developed moderate to severe symptoms. To lower the burden on the medical system, Taiwan's 6 special municipalities recently launched home isolation programs for COVID patients.
On Monday, the CECC announced it was lowering the threshold to release mild and asymptomatic patients from isolations. Let's hear from the CECC.
那大概就对于就是说这隔离治疗者一个是4天内要有2次的快筛或者 PCR 阴性或 CT 值大于等于30.
To be released from isolation on the 4th day since developing symptoms or since diagnosis, patients must test negative twice in a rapid test, or be negative in 1 PCR test, or have a CT value of 30 or higher. From the 5th to the 9th day, you just need 1 negative rapid or PCR test, or a CT value of 30 or more. If you've been in isolation for 10 days, you'll be let out without requiring further tests, but you'll still need to do 7 days of self-health management.
那这个是经过我们专家在审视这个美国还有日本还有一些其他国家的一些文献资料，看到就是说
These guidelines were compiled by experts who read the relevant studies from the US, Japan, and other countries. They say that in Omicron infections, the viral load peaks somewhere between the 3rd and 5th day after infection. So that is, 5 days later, the viral load starts falling. After 7 to 9 days, infectivity is already very low. According to data from Japan, scientists were unable to breed the virus in samples taken from patients that had been infected for 10 days or more. That shows that at that point, patients can be considered to not be infectious.
The rapid test for release must be administered by medical professionals, meaning the rules do not apply to patients isolating at home. For all others, the thresholds vary depending on how much time has passed since the patient's diagnosis or since symptom onset. That's 2 negative rapid tests, 1 negative PCR test, or a CT value of 30 and up on day 4, and 1 negative rapid test, 1 negative PCR test, or a CT value of 30 and more on day 5 to 9.